What are uterine fibroids and fertility connections? Uterine fibroids are noncancerous growths that can develop in or on the uterus. They are quite common among women of reproductive age and can vary significantly in size and location. The connection between uterine fibroids and fertility is complex and largely depends on the size, number, and especially the location of the fibroids within the uterus. Fibroids that grow inside the uterine cavity, known as submucosal fibroids, or large fibroids located within the uterine wall, referred to as intramural fibroids, are most likely to negatively affect fertility. On the other hand, subserosal fibroids, which grow on the outer surface of the uterus, typically do not have an impact on fertility. There are several ways fibroids can reduce fertility. First, submucosal fibroids can distort the shape of the uterine lining, making it more difficult for an embryo to implant successfully. Additionally, fibroids can block or compress the fallopian tubes or cervix, which may prevent sperm from reaching the egg or hinder the fertilized egg from traveling to the uterus. Fibroids can also alter blood flow to the uterine lining, which is crucial for creating a supportive environment for embryo implantation and growth. Furthermore, they may increase uterine contractions and cause local inflammation, which can disrupt the signaling necessary for embryo implantation. Research shows that women with submucosal fibroids often experience significantly lower pregnancy and implantation rates, along with higher miscarriage rates. In many cases, removing these fibroids can lead to improved fertility outcomes. Intramural fibroids that distort the uterine cavity can also reduce fertility, but the extent of their impact is still being studied. Subserosal fibroids, however, do not appear to affect fertility or pregnancy outcomes. It is important to note that most women with fibroids are not infertile. Therefore, it is essential to consider other potential causes of infertility. Fertility specialists can evaluate how fibroids may be affecting an individual's fertility and suggest appropriate treatment options. This may include surgical removal of fibroids if they are interfering with conception or pregnancy. When considering fertility and endometriosis, it is crucial to recognize that both conditions can coexist and impact fertility independently. While fibroids primarily cause mechanical and vascular changes in the uterus, endometriosis involves inflammation and tissue growth outside the uterus, which can also impair fertility. Managing both conditions requires careful evaluation and personalized treatment planning by healthcare professionals. In summary, uterine fibroids can affect fertility, particularly when they are submucosal or large intramural fibroids that distort the uterine cavity or block reproductive pathways. Their impact on fertility is well documented in medical research, and treatment decisions should be guided by a fertility specialist based on the characteristics of the fibroids and the individual's overall reproductive health.